So how can Republicans push back with the reality that free doesn't really mean free? Joining us now to discuss is former New York Congresswoman and Dr. Nan Hayworth. Nan, thank you for being with us this morning.
Pleasure, Carly. Thank you.
So a lot of Democrats are promising a lot of big things. The Democrats' 2020 universal health care platform is basically shaping up to these three main bullet points. Free health care for all, the single-payer health care system, and free health care specifically for illegal immigrants, which is a very controversial issue. Sounds great that for everybody to have health care. What are your thoughts on that?
Well, it's all going to be very, very expensive, Carly. And I think when we hear Democrats talking about health care for all, Republicans should say the exact same thing. We want health care for all. I know, it was the first female physician elected as a member of Congress for a full term, and a Republican. And the key question is, what do we do to make sure that everybody gets the best of care, the innovations, the choice, their decisions, their power to make those decisions at a cost that they can afford? Nothing's free. When the Democrats use the term free, that's really outrageous. That's a lie. Everything is paid for by us, by the citizens, whether we're paying for our premiums for insurance, for our deductibles, both of which have gone up, unfortunately, under Obamacare, or through our taxes. And those have also gone up under Obamacare in terms of the amount of tax dollars devoted to health care.
You won a seat running against Obamacare, so you know these issues inside and out. Explain why the exact same service that you and I would get at a doctor's office costs so much more under the public system than the private system.
Well, basically because all those decisions become political. So what happens is, big insurers, big healthcare, big hospital systems, big pharma, all of which do various services for us, but they get to go to politicians. They go to members of Congress. They go to senators. They even go to presidents and say, hey, we're going to need a lot of money to do what you guys want us to do. And generally speaking, the politicians will find ways to work with these folks. And who pays the cost? We do. And not just us, but future generations. Medicare is the biggest driver of our debt. Medicare, without expanding to every American, is going to cost us tens of trillions of dollars because of what we've promised to today's seniors. And you can't make changes in it to take the government out of it more and let the citizens make more decisions, because seniors get scared and they vote. So it's a bad way to go about doing things. Better to give us control, better to give us choice, and not force us to pay for long lists of mandates that we don't need, which is what Obamacare does, and not force us to pay for politicized decision making because folks in government are granting a lot of favors.
So expand upon that idea a little bit, because health care was a huge issue in the midterm elections. It's going to be a very big issue in 2020. And so far, a lot of political analysts say that Democrats beat Republicans on the health care issue every single time. So what do Republicans need to say, or specifically President Trump, going into 2020 to rally support around a health care system that isn't single payer?
Well, we can point to examples around the country where choice and competition actually work to provide better health care for people for a lower cost. They get better value for their money, and where the cost has been way too high and they're not getting value for money. Look at the Veterans Administration. Decades of trillions, billions of dollars have been poured into the Veterans Administration. And the government basically runs the Veterans Administration. President Trump has tried to make reforms. They've passed an Accountability Act. They're offering what now? A private option, a private care option, which tells us all we need to know. They're letting veterans, thank God, they're letting veterans opt not to use the VA system, but to take the resources that, that we grant to them because we're grateful for their service, that they've earned, and use them for private care. Because in the marketplace, more providers can offer more options, and we have more choices. So it's a matter of getting value for money. We want everybody to have health care.
There's a tremendous divide on that issue, just like so many issues in our country right now. Thank you so much for giving us your insight and also for giving me a free eye exam, because that teleprompter is really far away and I had trouble reading Nan's intro.
I'm an eye doctor, so yeah.
Beautiful. It worked out beautiful. Thanks so much, Dr.